The piece I have chosen to examine is the second allegro movement from Vivaldi's Autumn F Major Concerto from his Violin Concerti for Seasons. Wildly popularized pieces of Baroque music, most notably for the Spring Movement, Vivaldi also wrote concurrent sonnets to provide the listener with vivid imagery to accompany each movement. The accompanying sonnet for the second allegro movement describes: the hunters emerge at dawn, ready for the chase, with horns and dogs and cries. Their quarry flees while they give chase. Terrified and wounded, the prey struggles on, but, harried, dies. Such vivid imagery allows for even more specific meaning to be drawn from the piece, and Baltes, McLeay and Mui, 2012, suggested that Vivaldi's intent was indeed for emotional arousal, which was detected by both musicians and non-musicians in their study. In a randomized controlled trial examining the emotions evoked by auditory and visual stimuli, Baumgartner and colleagues found that in pairing music with emotionally charged pictures, the related emotional reaction was far more pronounced than participants listening only to music. An oft-cited phenomenon is the inherent suggestibility of certain types of music. For example, Flores, Gutierrez, and colleagues conducted a similar randomized controlled trial to Baumgartner, but they were looking specifically at principles of dissonance and consonance in music and how they related to happy and sad physiological emotional reactions. Imagery was not used nor discussed in the study, but the assertion that certain types of music can be used in a suggestive manner and show concrete signs of brain activity will be most applicable to the context we can apply this piece. The allegro movement itself is characterized by sometimes subtle and sometimes stark contrasts in instrumentation and intent between the tutti sections and the solo sections. In the chosen segment particularly, there is a frequent sense of returning to a familiar, joyous theme after short solos divert to a slightly darker and less cheerful space, where we can imagine, if the sonnet was read to us first, the hunters flying after their terrified and fleeing game. The tuttis are just that, everyone together, and there is a sense of coming together in these reoccurrences to the theme with full instrumentation. In this excerpt, the sense of movement generated by the 3/8 time signature is like that of a leaping movement, just as described in Vivaldi's accompanying sonnet. The more subdued solo sections are not so animated, and so give a sense of more subtle movement. This pattern occurs throughout the second allegro movement, a backwards and forwards of vibrant tutti movement to more refined solos. The emotional experience in listening to this piece will be inherently different for each person, but, as discussed, multiple studies have been conducted demonstrating the particular emotional valence a piece may hold. Vivaldi's 4 sections in particular have been used many times as the experimental condition for happy, compared to Wagnerhof Holst for fear. These pieces of music are particularly culturally loaded, however, not only by being characteristic of the westernized happy major, sad minor, but also from the context in which they were originally composed. In a time where access to composed music itself was very much the realm of the wealthy and elite, this audience has not altogether revolutionized itself. Despite these reservations for the appropriate use of broadly classical music in music therapy, studies have indeed found correlations between the assumptions of the emotional valence of a piece, this is major, it just sounds happier, and the physiological responses measured while listening to a piece of music. The connection between this piece of music and an adult clinical population could be varied, but let's have a look at mental health in particular. Mental health has been a growing area of interest for governments, community organisations, and health professionals alike. The increased focus on the best treatment for mental health has seen many different provisions of service arise. Gone, of course, are the days of institutionalisation, widespread stigma, and poor treatment options, and people with mental health now have many options for treatment and support available. Stigma certainly exists and still stands as a barrier to those seeking help. The places in which mental health treatment and support may take place are acute hospital settings, outpatient rehab facilities, and community drop-in centres, to name a few. These centres generally operate on a recovery-based model, which is often tailored to the individual to ensure the objective goal of wellness is realistic and appropriate for each person. Let's look at an outpatient rehab facility, and I'll be specifically drawing on my experience in Brisbane. The consumers that are admitted to the facility are neither unwell enough to warrant a stay in an acute hospital setting, nor well enough to return to the living situation they held before admittance to hospital. The focus in the facility is a recovery model, where consumers would come for a short-term stay for relatively intensive treatment. The multidisciplinary team environment ensures the consumer was receiving all available treatment options, as well as a holistic approach to their treatment. To ensure music therapy is a transparent process in this context, the transformational design model is employed. The consumer is assessed, objectives and goals are established, then non-musical activities are established. Following from that, musically based activities are established. Assessment and re-evaluation follows. A typical day for consumers would involve a group morning meeting, group exercises, individual appointments, lunch, afternoon group, individual appointments, and then allied health staff would finish at 5 p.m. While this may look like a full day, often consumers would not have appointments with any of the allied health staff through the day, or they would go out from the facility on leave, or simply be having an off day and choose not to attend any activities. To draw this back to the music therapy context where this piece of music could be used in a group setting to promote interaction, we can continue to look at the science behind the emotional valence a piece of music holds and how it produces immediate effects in the brain, and the recovery model utilised in music therapy in mental health. The way in which this piece of music could be used within the music therapy context is twofold. It is both a musically driven activity and a supportive medium for an exercise-driven activity. There are numerous studies supporting the use of exercise to elevate mood. For example, Whitfley and colleagues found that in two groups of people with depression in a hospital setting, the exercise group was found to have blood serotonin levels comparable to that which selective serotonin reuptake inhibitors, SSRIs, would normally elicit, a commonly prescribed antidepressant. With all of this biologically based knowledge in mind, let's look at how an activity with this piece of music would work, then work through the specific function of the group. During my time at Brisbane, the time most consumers would come together and be present was during the morning meeting. For this reason, we could use this piece of music in this setting for the most effect. The piece of music is introduced. The registered music therapist carefully selects their words for the right amount of positive suggestibility about the piece, that is, introduce it as a happy or joyful piece, and invite consumers to follow their lead in short, stretching and aerobic exercises that match the musical movement throughout the piece. This activity is based on one described by Lillian Eyre in her 2012 text on guidelines for music therapy practices in mental health. In using large, animated and vigorous movements, the music therapy activity is not only acting as a motivator to participate in the activity, several aspects of mental health are also being addressed. Large motor movements are being encouraged where a consumer may have catatonic-like behaviour, and social aspects of participating in an engaging activity. Extensions to this activity could be to invite consumers to introduce their own movement while they listen, for the group to then follow. A recommendation following this will be to use the same piece of music for a week or two at a time to build on the existing predictable structure of the morning meeting with the expectation of the same music. By doing this, the music itself becomes more familiar and consumers may become more empowered to introduce the movements they feel may be a better representation of the music. The evidence of positive brain activity while listening to Vivaldi's Autumn Movements is an encouraging catalyst for integration of music with other allied health professions. It maintains the uniqueness of musical quality through guidance by a registered music therapist, and provides further functional purpose that is so important in the scientifically scrutinised field that is mental health.